You spoke today on the current priorities for improved global and regional preparedness for MERS. Which key areas of preparedness do you think WHO's regional office should focus on?
I think a lot has been accomplished over the last 6 years in dealing with MERS. A lot of research and progress has been made in different areas of MERS research. There are still some areas of gap, and I think these will be hopefully highlighted by the end of this meeting. I think this meeting is very well timed when the number of cases of MERS are actually on the low side, and I think this is the ideal time to sit and reflect on what we have learned over the last few years, and then think about the areas where we can actually make some more progress. Some of the key areas are actually in the diagnostics, and more specifically in the rapid diagnostics. So basically trying to pick up cases much earlier by doing a rapid test in the emergency department, and also in trying to sort of identify the clear modes of transmission and when to isolate patients, when to take them out of isolation. In addition, try to work with collaborators in trying to address the issue of treatment and prevention.
How do you think a MERS pool of experts will help strengthen preparedness for the region further in dealing with such emerging threats?
I think some of the countries who were hit hard by MERS-CoV over the last few years have learned tremendous amount of knowledge and experience. And I think using these people who have been in the field and working with patients and in hospitals would be very useful to address the same issues in other countries, God forbid if cases do spread to other countries in the region. There's definitely expertise in all areas when it comes to clinical epidemiology, infectious disease, lab diagnostics, and also statistics and research. And I think that's very important to be utilized to the better of the region in the future. I think if there's one area that the region has benefited from when it comes to MERS and the emergence of this new virus is actually improving infection control in the countries of the region. Infection control is a high priority. It's always been a high priority, but it was not given the proper attention in the past. And I think over the last 6 years, the countries in the region have realized that infection control is of a huge importance for our healthcare in the region. And I think we have to give kudos to the countries who have been affected by MERS because now we can see a drastic reduction in the numbers of outbreaks that we used to see in the past in hospitals, and that's all an indication of how they improved their infection control very quickly over the last few years.